Hello, welcome to CVR English. Happy Ugadi to all the audience, all the viewers of CVR English. In today's special program, we are going to discussing about neurohealth. Neuroorthopedics is an innovative clinic specialization that combines neurology and orthopedics. To discuss and to know more about this specialty in our studio, we have Dr.Minal Chandra with us. She is a co-founder and chief consultant from Epione Pain Management Center, International Association for Stem Cell Regenerative Medicine (TDX) speaker in Epione Center Management. In 50,000 plus patients have been treated for knee joint without surgery in Epione Center Management, and this is a milestone. After a lot of research, plasma therapy started here. They held India Book of Records for treating maximum number of joint pain patients with regenerative therapy. Without further ado, let's know more about this therapy. Hello ma'am, welcome to our studio. And first of all, Happy Ugadi.
Happy Ugadi to you and all the viewers watching.
Thank you ma'am. And my first question is, what is the theme of Epione Center Management and how it all started?
See, Epione Pain Management Center, it's India's first multidisciplinary pain management center. So, pain management center, I'm sure it is very new for most of the viewers watching because they understand pain management center as, any kind of Ayurvedic or homeopathic kind of thing or any rehab center. But in India, first time Epione brought this concept of multidisciplinary pain management center. Any patient who is suffering with chronic pain, they will have lots of issues. They will have physical pain, then there will be other mental issues. They will not, they will skip their jobs. Then there will be social issues. So what happens is most of the time we try to give them painkillers, take away the pain. Try to give them painkillers, take away the pain. But actually, what the patient needs, they need a holistic approach towards the pain. So we have brought this concept of holistic pain management here in Hyderabad first time, and then we have expanded to Chennai, Bangalore. So right now currently we have 5 branches where we are serving the people of south of India, and we are also expanding to north and globally.
Okay ma'am, what is regenerative phase?
See, regenerative therapy is actually a concept where we are using patient's own natural capacity to heal. Now, every patient, every human will have growth factors, okay? That is why we all are living. So, like you imagine, if there is a cut in the hand, it automatically heals. Why it heals? Because we all have growth factors, right? Now, what happens is we have used this technique of natural healing in form of regenerative therapy. Now, this branch exists for other specialties since very long, but for musculoskeletal conditions, like musculoskeletal conditions, I mean for joint pain, muscle pain, ligament injuries, we have now started doing regenerative therapy for this. I'm sure you must have heard about PRP for hair growth, PRP for skin and all those things, okay? So the same concept we have innovated in a way that all the patients of knee pain, especially knee pain, joint pain, frozen shoulder, back pain, they don't need to go for surgery. They can use their own natural way of healing. So they can use their body growth factor to get the part which is damaged can be healed in a proper way.
Ma'am, my question is, what if they don't have self-healing ability?
No, there is nothing like this. They don't have self-healing ability. Every human, every animal who is alive will have growth cells, because without these growth cells, no one can live, okay? So our blood itself has something called as platelet, and platelet is like a den of growth factors. The only thing is that we need to identify which growth cells I want. So if you want to regenerate your hair, you need cells which will regrow your hair. If you want to regenerate any damaged cartilage, you need to extract those cells, okay? So every human will have growth cells. Every human is eligible to take this regenerative therapy.
Okay ma'am, first time I am hearing about this regenerative therapy, and why people don't have any awareness about this, and why only people know about surgery, and why they opt for taking surgery when they will have any knee pain or any other symptoms like related to osteo.
Yeah. See, the point is what you said is very, very correct. But, when you go and talk about any patient of knee pain, why I'm talking about knee pain is because it is the most common degenerative condition. Every human will go through knee pain. So if you go and ask any patient of knee pain, they are aware of knee surgery. Why? Because this is very commonly done. You know, people are just doing knee surgery left and right. Even if you need, even if you don't need. Okay, young age at 35, 40 also now people have started doing surgeries. Okay, because again that is the bread and butter for lots of surgeons. But regenerative is something, like I said, is a natural way of healing. It's a new technique. Like, you know, in Western countries when you go, it has been practiced since like 2-3 decades. In India, skin specialists, the plastic surgeons, they are using since so many years. But in this musculoskeletal condition, this is the first time that we have done a lot of research to identify what kind of cells and how we can create growth cells in your body. So there are lots of treating doctors, surgeons and all, they don't promote this. Why? Because again, if people start going for PRP, they will not go for surgery, right? So and there are lots of other people who have started talking negative about PRP. But the point is, when you talk negative about PRP, you should have some basis, right? Okay. How many cases of PRP have they done to talk negative about PRP? So last week we have completed a milestone of treating more than 50,000 patients of knee joint in my clinic, okay? Only in Jubilee Hills I'm talking about. So in this clinic we have treated more than 50,000 patients of surgery, without surgery with PRP, and so I can talk that this PRP is going to work and in which patient it is going to work and how is it going to work. Okay, because if, like I said, every human has that natural capacity, every human has those natural cells, so we need to extract those cells and create the damaged cells. So this is a very good concept. In so many other parts of the world people are practicing, but in India the awareness is less because other specialities, they are not allowing this to come up. But like I said, we have treated more than 50,000 patients, and especially in these two states of Telangana and Andhra, people are aware about PRP.
Yes ma'am, but they are providing diagnostics like MRI scan and all these X-ray, and with all these diagnostics they are proving that you need to go to surgery, and you can't heal, like we don't have that self-healing ability. Why doctors are saying like this, and why doctors are against this therapy?
Yes, see, like you said in the beginning only, that people are doing MRI scans, people are doing diagnostic tests to identify, and then they tell for surgery. The most important problem what we are facing here is that doctors are treating the MRI finding, they are not treating the patient symptom. When a patient comes to me, I need to understand what patient wants. Now what they say is this is stage 4. In stage 4, either you go for surgery or either you go for bed rest. If a medical practitioner says like this, that either you have to go for surgery or either you have to go for bed rest, I think this is a black day in medical fraternity. Because if I start treating patients only with surgery or bed rest, this is the end of mankind. You need to understand what patient wants. Now for example, I'll give you an example. Suppose an 80-year patient will come to me. Patient will say, Madam, I'm fine when I'm walking, I'm fine to do all my activities, but I find difficulty while climbing stairs. Okay, so this 80-year man who must be having BP, who must be having sugar and some other kind of medical conditions, who is happily doing all his normal activities, but he is only finding difficulty in climbing stairs. They go to orthopedician, they see the MRI or see the X-ray and say you're stage 4, you need to do surgery. Now you tell me, a patient who is completely okay, only climbing stairs is difficult, will you allow that patient to go for surgery? A major surgery like knee replacement, where there is risk of infection, where there is risk of life, there is risk of death on table, there is risk of 6 months of severe pain. No. See, my patient, what my patient wants, he wants relief while he is climbing stairs. He is good with daily activities. So what I need to give? I need to give him an alternative that is going to bring recovery to him. I cannot put him, just because you cannot climb stairs, you go and you rest, you be on bed all the time, or you go for surgery which has so many complications. So if people, educated people, doctors, who have so many years of experience is talking like this, then I must say this is a black day in medical fraternity.
Okay, ma'am. Why do you claim that PRP treatment is the more sustainable treatment than any other treatment?
See, like I said, we have treated more than 50,000 patients. First of all, my experience of doing treating patients with PRP is highest in India, in South India, in world. In Epione, we have done, our team has this experience of treating more than 50,000 patients. Nowhere in India, I can guarantee you, nowhere in the world, till now, any doctor will have that experience of treating 50,000 patients. So I know in which patients it will work, in which patients it will not work. First thing is my experience. Second thing is literature. Okay, in medical field, how we work in the field of experiments, in field of research is how it works. So when you go back and you see in last 5 years, there are more than 12,000 to 13,000 publications that have come which are talking in favor of PRP, growth factor, growth cells, autologous serum. There are so many things. We are still stuck with something like this. But when you go outside, people have moved so ahead. They have so many things coming up, and we are still fighting for PRP knee replacement. So the point is, there are I have heard doctors saying that I have 150 publication in knee replacement surgeries. So they are talking about 150 literature in knee replacement, but they don't want to see 12,000 publications in regenerative medicine. So you tell me how our Indian society is going to grow, because something which has come up with such good results, I think the people should avail it, because this is good for the patient. You don't need to go for surgery. Your recovery to your normal activity is immediate. You come, you take the PRP shot, you can go back, do your work. So you don't need any bed rest, you don't need to suffer post-surgery pain. The chances of infection, the chances of death is negligible, not there. So why I should not promote my treatment when these are in accordance to the guidelines from FDA, from DCGI, from ICMR. These all are in accordance to guidelines. So I should promote, because I have this experience and there are medical literature which supports the importance of PRP.
Ma'am, as you said before, the treatment which is going to give so many good results, then why are everyone is not promoting this PRP
That's what
treatment?
I'm saying. No, see, we have surgeons who will, if they start doing PRP, people will not opt for surgery. Right? And now surgery, knee replacement is a very big market, you understand.
Yes.
Why? Because the implants that they use. Now you see in government hospital, the same surgery which can be done at 1.5 lakh, and you go to corporate hospital, they are charging 6 lakhs, 7 lakhs for one knee. You are understanding? So this is a market. The whole Indian economy runs on market. So if something that is going to break down the market, do you think that they will allow PRP to come in? No, that is what it is happening. So people are talking negative about PRP without knowing about PRP, without their experience about PRP. See, unless and until you taste the food, how will you know that the food is good or bad? You are understanding?
Yes.
So it seems like that you are talking about something which you have never practiced, which you don't know much about. So through this, I would like to give this message, because I have seen that people of Telangana and Andhra Pradesh, and mostly in the south of India, they are educated. They want to get education about their health. They want to know about new treatments happening. So I'm very glad when I see people, people coming from villages. They have heard about PRP. They have known, they have relatives who have taken PRP and doing good. So in my clinic, my most 90% of the patients come from word of mouth. So some of the relative has taken it, they are good. 4-5 years, they have seen the patient doing good, and then they have come. It's not like my patients will come immediately. They have tested us in last 8-9 years. They have seen that their relatives or mother, father, relatives, uncle, aunt are doing well. Then they come to us. So that is why I am saying this is the treatment which is going to bring revolution. Because the surgeries, you know how surgeries are, big surgeries. First of all, patients will have so much of, they are so much afraid about surgeries. Most of my patients who will come, they will say, I am afraid of surgery, madam. I want to avoid surgery. Now, what you can do, tell me. So when a patient comes like this, that I am afraid of surgery, I am not going to do surgery, you do something. Shall I not give him an option? I cannot allow that patient to live in pain, right?
Yes.
So, the point is that when people are talking bad about PRP, they don't know that they are harming the society. The society needs treatment like this because there are so many patients who will never undergo surgery because they are scared. They must have seen any of your family member dying of surgery or any of the relatives dying of surgery, or they must have seen post surgery how difficult it is to come back to normal life. So they don't want surgery. So don't you think that as doctor, it is my ethics and moral responsibility to give patient some kind of treatment that is going to make their quality of life good?
Yes, ma'am, you're correct. But can it be done in every patient? Like, do all the patients are suitable for this PRP treatment? And
yes.
who are not?
See, PRP, like I said, is a very natural way of treating. It is using patient's own blood. So anyone, like we do a lot of sports injuries. So in sports injuries, we get kids of 10 years, 12 years, 13 years. When they start their sports, they may go into any kind of injury. So this PRP is working good for kids. I have done PRP for like 90-95 year patients. They are doing good. So PRP is not restricted with any age. Any age is suitable. Then any medical condition, patient can happily take PRP. Only there are few 1 or 2 conditions, like those with genetic disorders where the platelet count is less. In those patients, the PRP may not give that result. But otherwise, in 99% of the population, PRP is going to give good results.
నేను హైట్నర్ నుంచి మాట్లాడుతున్నాను. పావని నా పేరు.
చెప్పండి మ్యామ్.
నాకు వన్ సైడ్ పెయిన్ వస్తుందండి.
ఓకే మ్యామ్, ఈ నొప్పి మోకాల దగ్గర ఉందా మీకు?
కాదు, నడుము అండి, నడుము దగ్గర ఉంది.
ఓకే ఓకే. ఈ నొప్పి ఎప్పటి నుంచి అమ్మా మీకు?
నాకు 3 years నుంచి ఉందండి అమ్మా.
ఓకే. కాల్లో తిమ్మిర్ ఆర్ నమ్నెస్, బర్నింగ్ సెన్సేషన్ ఉందా? ఆర్ నొప్పి నరం దగ్గర ఉంది ఓన్లీ?
అది గుంజుతూ ఉన్నట్టు ఉంటుంది నాకు అప్పుడప్పుడు.
ఓకే. మీ ఏజ్ ఎంత అమ్మా?
ఏజ్ 39 మేడం.
ఓకే ఓకే. మీ ఏం చేస్తున్నారు? ఇంట్లో పని ఎక్కువ చేస్తున్నారా?
అవును, ఇంట్లో పని ఉంటుందండి. నాకు 4 పిల్లలు.
ఓకే ఓకే మ్యామ్, ఇది నడం నొప్పికి చాలా రీజన్స్ ఉన్నాయి. ఇది డిస్క్ ప్రాబ్లం ఉందా, ఆర్ ఓన్లీ మసిల్ ప్రాబ్లం ఉందా, ఆర్ వేరే ప్రాబ్లం ఉందా, ఒకసారి చూడాలి. సో మీ ఒకసారి క్లినిక్లో వస్తే మొత్తం ఎగ్జామినేషన్ చేస్తాము. తర్వాత అవసరం ఉంటే ఎంఆర్ఐ ఆర్ వేరే టెస్ట్ కూడా చేస్తాము. తర్వాత మీకు ప్రాపర్ ట్రీట్మెంట్ చెప్తాను. సో ఈ నడం నొప్పి చాలా కామన్ ఉంది అమ్మా. సో నడం నొప్పికి తప్పకుండా ట్రీట్మెంట్ ఉంది, బట్ ఇది చూడాలి ఒకసారి. సో
నయం అవుతుందా మేడం? అది
ఏంటి
నయం అవుతుందా? మంచిగా అవుతుందా?
Can it be treated?
అమ్మా, ఇది చెప్పాను కదా, ఇది బ్యాక్ పెయిన్ కి చాలా రీజన్స్ ఉన్నాయి. బట్ ఫస్ట్ ఒక రీజన్ ఐడెంటిఫికేషన్ తర్వాత తప్పకుండా ట్రీట్మెంట్ ఉంది నా దగ్గర. సర్జరీ లేకుండా మీకు సఫరింగ్కి అవసరం లేదు. ఓకే, సో తప్పకుండా 100% ట్రీట్మెంట్ ఉంది. మీ ఒకసారి క్లినిక్కి రండి, చూస్తాను, తర్వాత ప్రాపర్ ట్రీట్మెంట్ చెప్తాను.
థ్యాంక్ యూ అమ్మా. థ్యాంక్ యూ.
ఓకే మ్యామ్.
Okay, let's get into the discussion again. Ma'am, as I said before, PRP treatment is only done for the patients which are suitable for and they are not, if genetic disorders will come, then they are not suitable, you are telling. So my question is, do it work for ligament fractures and other type of fractures in knee?
Yeah, see, for any ligament injury, muscle injury, or any kind of soft tissue injury or cartilage loss, this PRP is going to work. When you say bone fracture, definitely in bone fracture PRP will not work. Okay, but suppose in knee we have ACL injuries, we have meniscus injuries, we have bursa, we have so many soft tissue injuries, patella tendon injuries. So for all these, patients will unnecessarily go for surgery. In 99% of the cases in ligament injury, patient will not require surgery. Okay, so this is one of the best treatments, especially we see in sports, in young patients. So many young patients will come with meniscus injury, with ACL injury, then they see in MRI, the doctor say, oh, it's a partial tear, it's a complete tear, go for surgery. No, you don't need to go for surgery. Okay, so like I said, 99% patients don't need to go for surgery in ligament injuries, because PRP, regenerative therapy, is going to give you wonderful results without side effects, without having to leave your work or to go for loss of work.
Okay ma'am, what are the side effects and complications in this PRP treatment?
Yes, so now when we talk about any treatment in medical literature, there will be some amount of complications, but PRP or regenerative therapy is one treatment modality in medical field where you don't have any side effects, because this is your very own blood, right? We are not mixing anything from outside. We are taking your blood, we are processing it, we are injecting it, and whatever we are injecting is done under supervision of ultrasound machines or fluoroscopic machines. Okay, so there is no chances of side effects, no chances of complications, but the only thing is that you need to understand whatever we give you instructions, you need to follow that. Okay, so whenever patients come to us, we give them a protocol, and according to that protocol they need to follow the instructions. So no side effects, you don't need bed rest, you don't have to go for any kind of restrictions in your daily activities.
Then what care should the patients to be taken after this treatment?
Yeah, see, there are all these knee pain, mostly knee pain is because of degenerative condition, like, you know, as we age. So when we age, what will happen? The bones, the muscles, everything will weaken, right? Just like the skin wrinkles inside the joint, also all the structure will wrinkle out. Okay, so what we are trying to do, we are trying to regenerate all the structures. Okay, so once we understand that how much is the damage, we prepare a protocol for the patient. Now, one type of treatment will not suit all patients because their lifestyle is different, their body type is different, their daily activity is different. Okay, so what we do is we identify the proper condition and then we make a protocol. Now, what are the things that patient needs to do is, like, if you are overweight, we will motivate them and guide them to reduce weight. Now, a 65-year female patient is very obese, is overweight. Do you think it is easy for them to reduce weight? No. But again, we motivate. We have a team who will counsel them, who will motivate them, who will understand their lifestyle and then tell how to decrease. If you tell them you go for dieting, they will do it for a month or two. So we are not going to get results, right? Similarly, we need to motivate patients for exercises, because your muscles needs to be strong. So few patients are good on doing exercises, few patients don't do. So we understand that what patient can do. So identifying that, we give them set of exercises. Then, you know, they have this habit of sitting on the floor and doing pujas. Then some have habit of sitting on the floor and eating. So all these little changes we make. Okay, but it is not like, no, we do restrictions of anything. There is no restriction after PRP. You can go swimming, you can go walking, you can go do your daily activities, cycling, whatever you want to do. That is the whole concept of doing any treatment, right? After treatment, if you are restricting something, then there is no point of treatment, right? So there is something that we just modify it. You know, if like, you know, lots of female will come who will have that habit of doing kitchen work or cooking for like an hour. So we tell them, you do your cooking however you want to do, you do your cooking, but we will just modify it on how to do. You do for some time, then sit for 5 minutes, again you start doing. So all those changes we make according to the patient requirement, according to their lifestyle, according to their body type.
Okay, ma'am. How long will the treatment go?
See, this treatment is a very simple treatment, and we extract the blood from patient, we process it. Processing will take around 45 to 50 minutes because we need to process it according to patient's need. Okay, so like I said, some patients may require very less quantity of platelets, some may require a larger quantity of platelet. So this identification and quantification will take around 45 to 50 minutes, and then we will take the patient in operation theatre, and then we will map wherever there is loss of cartilage and we will inject it. So the entire process will take around an hour or half, and then again we tell them lifestyle modifications and what next to do. So overall the patient has to be with us for like 1 hour to 2 hours. They can go back and they can resume their activity. Like, you know, if you are getting the treatment done in afternoon, evening you can go back and cook, you can go back to your office, you can do whatever you want to.
How can we differentiate this normal pain and osteo-related pains?
Yeah, see, every pain will have a cause. Okay, so most of the time, like we had a patient who was talking about back pain. She's just 39, and then she was telling that, you know, treatment is there or not, because she is suffering. So every pain will have a reason. So we need to identify. How we identify is when we talk to the patient, what are the aggravating factors, in what movements the pain comes down. Then we have certain tests, we do certain dynamic tests. Then we have this ultrasound, high definition ultrasound machines, which will help us to guide and identify the structural damage. So it's a whole lot of process that goes into identify the pain generator, and only once we have identified the pain generator, then we can tell the patient the proper treatment. So it is not like patient has come, I'll give painkiller, patient has come, you go for physiotherapy. No, it's not like that. Patient is suffering, patient needs to understand what is happening in patient's body. So we identify, and whatever I understood about the patient should also understand. So we need to tell them and give them what is the root cause of your pain and what has to be done, what I should do, what the patient should do. So there are examination, there are tests, there are certain scans which needs to be done to identify what is the cause of pain generator.
At what stage will you do this treatment?
In any stages. See, the knee pain will progress from stage 1, 2, 3, 4. Whether it is stage 1, whether it is stage 4. This PRP is going to work in all stages. Suppose if you have little amount of pain, you come to me, you are in stage 1. I will tell you to go for PRP, because then you will not progress to stage 2, 3 and 4. If you come in stage 2, I will do PRP for you. If you come in stage 3 and 4, then also I will do PRP for you, because this is going to repair your cartilage. So there is no restriction to any time. You can get this PRP shot any time, whenever you have pain, whenever you feel that this is your pain is disabling your activities, your daily activities is getting difficult, you can come and take this shot. There is no time, no particular time where you should come. Any time you have difficulty, please come, please go, get yourself checked, and you can opt for PRP treatment.
Okay ma'am, we have so many departments like orthopedics, osteopathy and osteoneurology, and as well as physiotherapy also.
Yeah.
Why should we come to pain management center only?
See, like I said that, you know, pain management is not one department. It is a holistic multidisciplinary department. Okay, so where we identify what is the reason of pain, like I was saying, what is the cause of pain. Back pain will have 100 causes, knee pain will have multiple causes. So in pain medicine department, we identify what is the cause. Then if there is a damage, we can tell for PRP. Then strengthening can be done with the help of physiotherapy and rehab. Then occupational therapy. So all those things together have to be put together. So that is why where we do multidisciplinary treatment, patient should come there.
Okay, ma'am, caller, let's take the call.
Yes, yes.
Hello.
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 Namaste, sir.
Hello, namaste.
Cheppandi, sir.
అది నాకు 10-12 years బ్యాక్ యాక్సిడెంట్ అయింది.
ఓకే సార్.
3 రిబ్స్ ఇరిగినాయి బ్యాక్ సైడ్, రైట్ రిబ్స్.
ఓకే, ఓకే సార్.
అది ఇన్ని రోజులు పెయిన్ లేదు, కానీ ఇప్పుడు ఏదైనా బెడ్ మీద పండుకున్నా కానీ లేదా చలికి అది నొప్పిలాగా వస్తుంది.
ఓకే సార్, మీకు నొప్పి చెస్ట్ దగ్గర ఉందా, ముందు సైడ్ ఉందా, ఆర్ ఇది బ్యాక్ లో వెనక సైడ్ ఉందా?
బ్యాక్ సైడ్ ఉంది.
ఓకే, మీకు మంట, బర్నింగ్ సెన్సేషన్ తెలుస్తుందా సార్, ఆర్ ఓన్లీ నొప్పి తెలుస్తుందా?
ఆ నొప్పి అదే ఆ రిబ్స్ విరిగిన దగ్గర అట్లా అనీజీగా వస్తుంది. 10 years పాటు ఏమి లేదు. ఈ మధ్య చలికి ఎప్పుడన్నా పడుకుంటే లేదా బెడ్ మీద పడుకుంటే అట్లా అట్లా స్టక్ అయినట్టు ఉంది అన్నట్టు.
మీ ఏం చేస్తున్నారు సార్ పని?
నేను ప్రైవేట్ ఎంప్లాయీ.
ఓకే, ఓకే సార్. ఇది సార్ చెప్పాను కదా, ఇది ఎవ్రీ నొప్పికి ఒక రీజన్ ఉంది. సో ఇది బోన్ దగ్గర ఇది నొప్పి స్టార్ట్ అయింది, ఆర్ వెదర్ ఇట్ ఈస్ బికాస్ ఆఫ్ ద రిబ్ ఫ్రాక్చర్ దట్ హ్యాపెండ్ బిఫోర్, ఆర్ వెదర్ ఇట్ ఈస్ ఓన్లీ అ మసల్ పెయిన్. సో ఎగ్జామినేషన్లో చూస్తాను సార్, ఒకసారి మీ క్లినిక్కి రండి, వీ విల్ డూ అ థరో ఎగ్జామినేషన్. తర్వాత వీ విల్ టెల్ యూ ఓన్లీ ఫిజియోథెరపీ విల్ వర్క్, ఆర్ ఓన్లీ మెడిసిన్స్ విల్ వర్క్, ఆర్ సంథింగ్ నీడ్స్ టు బి డన్, లైఫ్ స్టైల్ మోడిఫికేషన్స్కి రిక్వైర్మెంట్ ఉందా లేదా మొత్తం చెప్తాను సార్. సో డు నాట్ ఇగ్నోర్ this pain because once it becomes chronic, it is difficult to treat. So like you are saying, ratri padkanappudu tirganappudu noppi unte, that could be more of myofascial pain, muscle related, but again confirmation kosam tappakunda okasari examination cheyali.
Let's discuss again. What is the probability rate of PRP treatment? Like, what is the success rate after this treatment?
See, success rate, like I said, in our clinic success rate is more than 80 to 85%. Okay, but when I say 80 to 85% means these 85% patients are very, very happy. Remaining 10 to 15% also they had improvement, maybe not up to their expectation. Okay, because success rate is very subjective. Okay, so in all my practice of 50,000 patients, I have never seen any patient getting dissatisfied with PRP. They will definitely have improvement, but maybe not 100% or maybe not 80%.
Thank you ma'am for sharing this valuable degenerative therapy with us, and thanks once again And
Thank
that's
you
all
so
for
much. Thank you.
that's all for today's health program. Keep watching CVR English News.